Hello, our team is presenting MEND, which stands for Meet Each Need with Dignity, based on its financial statements for fiscal year ending June 30th, 2013. MEND was founded in 1971 by a group of volunteers led by Ed and Caroline Rose in 3 garages in San Fernando Valley. They collected food, clothing, and furniture for families in need. MEND was incorporated in 1976 as a non-for-profit charity organization and hired its first paid staff 11 years later in 1987. In 1991, MEND started a free medical and dental clinic, and it opened its vision clinic in 2001. It opened its computer lab and offered ESL classes in 1992 and began its job training program in 1998. Unique characteristics of MEND are as follow. MEND does not solicit governmental grants. It is almost entirely funded by private section and does not sell products or services. MEND has the impressive historical low overhead and administrative costs of below 6% because it has just 31 paid staff. The rest of the jobs are done by more than 200 volunteers. MEND serves as an average of 38,500 individuals each month. It also operates a food bank that supplies 60 small pantries and charities in the region. Each month, the MEND Food Bank and the Emergency Food Assistance Program serves an approximately 25,000 people, both on-site at the MEND Center and off-site through third organization and outreach programs. Boxes containing a nutritionally balanced 3-day supply of food go to those most in need. Clothing Center provides services for necessary clothing, shoes, blankets, and small household items. They provide baby items and children clothing for expecting and new mothers. In addition, they provide professional outfit for job-seeking individuals. Medical, dental, and eye care center provide 11,300 individuals per year, with helps of volunteers professionals. Home visiting and information referral provide services and referrals for food stamp applicants, job applicants, tax returns, and etc. Education and Training Center provides ESL, math, and science classes, computer lab classes, and sewing classes. Since 2013, approximately 1,000 people participated in job training program, gaining skills that have helped them become job ready in career areas such as food services, retails, customer services, computer skills development, warehouse management, medical and dental assisting, and clerical and administrative services. Homeless program provides non-housing services for homeless. About 300 homeless using the shower service and emergency food program at MEND Center. General service including food stamps referral and documentation, bus tokens, low-income utilities, and tax filings are provided by General Service Department. With dignity and respect powered by volunteers, MEND's mission is to break the bond of poverty by providing basic human needs and furnishing a pathway to self-reliance and sufficiency. MEND's business strategy is to use the financial supports from foundations, individuals, and businesses in addition to use of volunteer services. The mission of MEND seems consistent with the stakeholders' value, which is providing service to families and help them to stand on their feet and get back to society and return their society's favor. Poverty level is highest for families headed by single women, and latest census data shows about 20% of households in Pacoima are single mothers, which has the significant increase since 2000. California experienced its highest poverty in decades. In 2010, the poverty rate in Los Angeles County was 17.5%. The latest census data reveals that about 17% of Pacoima households are at or at below the poverty level. In Pacoima, there are fewer unemployment but more working poor. During the latest recession in 2008 to 2011, demand for MEND's emergency food boxes grew 64%. According to the latest census data in 2009, in California, about 21% of women are insured, and 25% of adults were uninsured at some point throughout the year. Again, from 2008 to 2011, the number of patients who visited MEND's medical clinic increased by 22.5%, and patients who visited dental clinic increased by 135%. In the era of growing disparity between the have and not have, the cut of governmental aids and services and its burden on private and non-for-profit section is considerable. Charities are encountering increases in the applicants for their services and consequently increase in need of financial means to support their program. Additionally, increase in cost of goods and services provided in an ongoing burden on MEND. I should mention that when recession hits the region, the support of business decreases as well. Now I pass it on to Andrew.
Thank you, Merda. I'm going to talk about the organizational management of MEND. MEND's top management team is well selected, and each one of them has a great professional background that can help them to better serve the role in the organization. The president and the CEO, Maureen Hill, has been serving in the organization for over 27 years, provides overall coordination to MEND personnel, volunteer and staff, programs and facilities, provides staff support to MEND's board of directors, executive committee, fundraising committee, public relations committee, represent MEND in the community organization and at the community events. She has won several individual and organizational honors and awards. The Chief Operating Officer, Jenny Geisris, has oversees the internal operation of the agency and provides strategic leadership as well as regular oversight to programs, finance, human resources, facilities, and general admission. The Chief of Financial Officer, Scott Miguels, oversees MEND's finance, including performing day-to-day accounting activities, preparing monthly and yearly reports, processing payroll, and compiling private grant reports, assists with budgeting and auditing, provides staff support to MEND's management, budget, and planning committee. To continually improve every aspect of the performance, delivering products and services that surpass client expectations. Everyone is closely working with each other from the top management teams to the low-level staff. They have created several departments to concentrate on each specific function and better serve the organization, such as Department of Volunteer Services, which coordinates group volunteer projects, provides tours for new volunteers, and helps place volunteers in appropriate departments. Work with MEND's Volunteer Development Committee in recruitment and recognition projects. Department of Communication, which works directly with the MEND CEO and the MEND Marketing and the Communication Committee to manage and coordinate the agency's public relations. They also created departments for each of their programs, as Merda mentioned earlier. The administrative service includes expenditures to secure proper administrative functioning, maintaining the building, and manage the financial responsibilities of the organization. The administrative expenses are about $270 million, which is only 2.2% of the total expenses, which means they are very efficient. MEND is volunteer powered at every level, from service delivery to fundraising to public relations, and their 5,200 volunteers are supported by a small staff of less than 31 employees. its compensation of current officers, directors, trustees, and key employees are relatively low. The total expenses are only about $389,000. Based on the Form 990 of 2012, the CEO Marine's compensation is $130,000. The COO makes about $97. The directors makes about $80,000, and the controller makes about $81,000. The compensation for these top executives are reasonable since they are running an organization with $13 million revenues. Comparing to $1 million compensations in for-profit organizations, this amount is very low. Now I'm going to pass to Monica.
Thank you, Andrew. We are now moving on to take a closer look at the revenue streams of MEND to see which sources of income they have. In order to get a better picture, we have broken down the revenue and support into two categories, major and minor. For about $13.3 million revenue and support received in the fiscal year 2013, 76% of that was considered in-kind contribution. This consists of items such as food, clothing, dental and medical supplies, as well as professional services such as medical doctors and dentists. This is considered great support from the community and professional volunteers. The minor revenue streams can be separated into different parts. First is the cash contributions from foundations, individuals, and businesses, which make up approximately 19% of the total revenue. Some major donors that we may be more familiar with the name is Bank of America and Wells Fargo, as well as Dan Murphy Foundation and the Angel Foundation. These donors contributed $100,000 and above. There's also a bank account set up especially for two funds, Executive Directors Discretionary Fund and SF Pierce Building Fund. Funding is coming from the right places and allows businesses as well as the board members to support MEND and make a difference to the community. Another minor revenue stream is income from holding special events, income generated within the programs, and rent income. This makes up only about 5% of the total revenue. This indicates that the commercial activities are not very supportive. Their revenues are mostly concentrated in the contributions. The last part of the income stream, which was not included in the financial reporting numbers, is the volunteer hours. People who volunteered account for approximately 92 full-time employees, and if this was calculated as part of the revenue, it would have been 11%, which is worth mentioning. However, due to the rules on what can be categorized as contribution, these hours could not be included in the financial reporting numbers. Now that we have looked at what MEND has received, we will take a closer look at how it is used. Their mission is to break the bonds of poverty by providing basic human needs and a pathway to self-reliance. To see if they are fulfilling their mission, we turn to see where they are spending their money. Out of a total of $13 million of operating expenses, 55% go to food contribution, 19% to clothing, 14% to providing medical and dental services, and 2.5% to education training center. If we were to associate how much is spent with how much MEND is giving to the community, it appears like they are able to touch upon alleviating poverty by giving food and clothing. However, the latter part of their mission, which addresses self-reliance, still has room for some growth, since only 2.5% of all expenses goes to education training center. Next, we will take a look at how efficient MEND is at fundraising, as the other performance ratios will be discussed later in the presentation. Fundraising makes up approximately 3% of revenue across 2012 and 2013. Its funding efficiency ratio is about 4%, What this means is that for every $100 that is received, MEND is spending $4. This is considered efficient use of fundraising, which may be due to many factors. Possibly they have a good reputation and continuous donation from major contributors. Continuous donation is evident by the fact that there was a 10% increase of in-kind contributions and a 90% increase in business contributions from fiscal year 2012. Now I will pass it to Ali Reza.
Thank you, Monica. Hi everyone, my name is Ali Reza and I'll be covering the financial management section of this presentation. Let's think about it for a second. Financial management. Is it even important to have a proper management system in place when it comes to not-for-profit organizations? Well, if we were only talking about $10 or $20, probably not. But when we are taking into account $10 million or even $10 billion, then for sure financial management is necessary. To find out how well MEND is managing financial matters, we can find the answer to the following three questions. What is the quality of internal control system? How prudent is the cash and investment management? Are non-financial assets prudently managed? One way to answer these questions is to study the performance of MEND over past years. If this organization has been successful, most likely it also had a high-quality control system in place and was able to manage its finances in an efficient way in order to meet the demands of its clients effectively. Studying the performance of MEND shows that in fact MEND has been very successful. In 2008, it was the recipient of the California Association of Nonprofits Excellence in Leadership Award. In 2012, MEND was named the California Nonprofit of the Year by the Governor's Office. And in 2013, it was the recipient of management's Nonprofit Leadership Impact. As you notice, these awards and recognitions are directly related to the leadership and management of this organization. One of the most valuable assets of this organization is its leader, Ms. Marianne Hill. She is currently the CEO and president of MEND, and her outstanding leadership skills has led MEND to be very successful. Under her leadership, MEND has grown from serving an average of 2,000 clients each month in 1987 to helping 38,000 clients monthly. Her business and life philosophy has also been critical and very influential in managing the quality of control system, operating costs, investment approaches, and non-financial assets such as land, buildings, and equipment. Under her leadership, MEND has been having a check and balance system in a way that, for instance, board conducts a formal written assessment of the CEO. She has also managed the overhead costs and kept it around 6% by encouraging volunteers to make a difference in the community. There are 5,000 volunteers annually and only 31 paid staff. The 5,000 volunteers give the equivalent in hours of 95 full-time employees. By managing the operating costs properly, she has also been able to effectively manage cash and non-financial assets. Since the management is not interested in risky investments and prefers a relatively conservative approach, MEND does not have any long-term investments. The only investment it has is short-term, which is in certificates of deposits. For insurance protection, MEND diversifies and keeps its cash and cash equivalents in two banks, which are Citibank and Wells Fargo. At June 30th, 2013, MEND had deposits more than the Federal Deposit Insurance Corporation's $250,000 limit, which was clearly disclosed in the notes to the financial statements. Besides this issue, the overall growth and performance of this organization over the past years shows strong signs of effective financial management. MEND also cares about the ethical aspects of financial management and follows the principles for good governance and ethical practice. These principles are directly related to legal compliance and public disclosure, effective governance, strong financial oversight, and responsible fundraising. Now I'd like to pass it on to Peter.
Thank you, Alireza. The financial health. I will go over MEND's financial statements. Start with the statement of financial position. It is similar to balance sheet for the private sector. First, we look at the assets. As we can see, the majority of MEND's assets are property, plant, and equipment, which do not have significant change in 2013. Also, both cash account and account receivable have increased more than 50% compared to 2012 due to the increase of contributions. MEND is funded mostly by contributions and do not really rely on debts. Therefore, their liabilities are low. They only have about $390,000 of total liability. Next statement is the statement of activities, also known as income statement, which gave us an overview of their operation results for 2013. Their total revenue are around $13.2 million, with total expense around $13.1 million. In addition, their net assets increased about $125,000 at the end of the year. Statement of functional expenses presented the details information of MEND's expenses. The top portion demonstrated the compensations and related expenses for both program and general administrative expense, with a total about $1.4 million. The first part are the detail of program-related expense, and the second part are the detail of non-program-related expense. Noted that these non-program-related expense total only about 4.8% of the total expenses, where the program-related expense is about 95.2%. Statement of cash flow. There's cash inflows and outflows throughout the year. It started with a net increase in net assets and took out the non-cash items and the addition of working capital. The cash flow from operating is about $400,000. However, after investing in financing activities, which mostly related to capital expenditures, the cash flow is about $240,000. The financial performance. We use ratio analysis to evaluate an organization's financial performances. We first look at liquidity ratio. The current and quick ratio represent MEND's ability to pay our current debts. The ratio shows that MEND has enough resource to cover their current debt. We then look at whether MEND would be able to continually operate. The revenue to expense ratio shows MEND's current year revenue is sufficient to cover their current year's expense. In addition, the unrestricted net assets over operating expense ratio show us how many percentage of operating expenses are covered by the net assets. The ratio is 0.77, which means MEND's net assets cover about 77% of their annual operating expenses. The capital structure and leverage and debt coverage ratio show us that MEND have really low reliance on debt, and debt service expenses are covered by their income. The auditor, Stern, Corey, Shredden, and Morgan Accountancy Corporation, issued an unmodified opinion which indicate that they believe the financial statement is in accordance with U.S. GAAP. For the size, the largest not-for-profit organization in the Valley, with 5,000 volunteers
and 38,000 clients served each month, we believe that MEND is an efficiently managed organization that is able to fulfill its mission for the community. Thank you for listening to our presentation.